when I graduated PA school, I was working in surgery. I was having the migraines. And then my youngest at the time, who's now my middle, had really bad eczema, really bad reflux. He was 4 months old and I was still breastfeeding him, but he would like glow with red because of his eczema and food allergies. And I brought him to his pediatrician, tried to figure out what was going on. She did some food allergy testing and everything he had was like a 1, maybe a 2, but it was so many things. And I was like, you know what? I just got to cut all of these things out. Why wouldn't I just cut it out and just see if it helps? And immediately it did. His behavior improved, his skin improved, his, bowel habits improved. Everything just got so much better. And that's when I was like, oh, there's so much more to this than just, he'll grow out of it. It'll be okay. So he was the big one that like really prompted this journey for me, because I had to also find out what it was that I was eating that was triggering him, plus what I was eating that was triggering me. So it was a big puzzle.
Welcome to the podcast, Kasey.
Thank you.
Kasey Horrell.
Yeah.
Another dose wellness provider.
Yeah.
In here with me again. I'm so privileged.
I'm happy to be back.
Yeah. No, thanks again for coming back. We did an interview earlier last year.
Mm-hmm.
So it's been a bit.
Yep.
Now we're doing some work together, which is kind of fun. But you just have a lot of really good knowledge and information that I thought would be good to talk about, specifically in the metabolic health space.
Thank you.
We've been putting a lot of emphasis on that. And so we'll dive into that. But before we do, want to welcome you to the Generational Health Podcast. We're here in the Ondar studio. I don't know if you've seen this kind of stuff before, but pretty amazing stuff.
Yeah.
And as always, these podcasts are sponsored by Hiva Health. So anyway, wanted to welcome you back here again. And then maybe before we jump right into all the topics that we want to discuss, maybe give us another quick background on you, what you do, your training, what you're passionate about, anything of interest.
Awesome.
Yeah.
So I am Kasey Horrell. I'm a physician assistant and I trained here in Arizona at Midwestern University. Trained in family medicine, but upon graduating, I went into thoracic surgery and I worked in surgical oncology, a bunch of different kind of facets of surgical oncology, from thoracic surgery, head and neck surgery, plastic surgery, all related to cancer care for 7 years. And in that time, I had kind of my own health journey stuff, my kids' health journeys that started getting me interested in more functional integrative medicine. I think we talked about this on the first podcast I did. I had some like migraine issues, and knowing what I knew in PA school, I was like, there's no way I'm going on those medications. I'm not doing it. And so I started exploring what my body could do for me and how I could give my body the resources it needed and how I could remove triggers and like toxic inputs and things like that to make me function better, make my kids function better, all that kind of stuff. And so that's what kind of led me into functional medicine, integrative medicine, kind of naturopathic care. And I've been working at Dose now for a little over a year. Doing some of my own practice before that, but with Dose for a year, and seeing kids, seeing adults, seeing adolescents, doing a lot of work on kind of neuroinflammation, especially in kids, metabolic health, autoimmune disease management, and kind of everything in between, weight loss, hormones, all of that kind of stuff.
So you mentioned you kind of had your own health journey with migraines and all that, and some stuff with your kids. Yeah. Do you mind if I ask what types of things they were dealing with? The kids? Yeah.
Yeah. It was mostly what started me on that was, so when I graduated PA school, I was working in surgery. I was having the migraines, and then my youngest at the time, who's now my middle, had really bad eczema, really bad reflux. He was 4 months old when I started working in surgery. So I was still breastfeeding him. But he would glow with red because of his eczema and food allergies. And I brought him to his pediatrician, tried to figure out what was going on. She did some food allergy testing and it showed up with like a 1. If any of you guys are familiar with our food allergy testing, it's like it gives you like a 0, 0.5, 1, 2, 3, 4, 5, all the way up to like the anaphylactic stuff. Everything he had was like a 1, maybe a 2, but it was so many things. And I was like, you know what? I just got to cut all of these things out. And she's like, you don't have to. You don't have to. I'm like, but why not? If it's causing, that like the micro effect, like death by 1,000 paper cuts, like he's having an apple today, he's having a carrot, he's allergic to all of those things, he's having gluten, dairy, all of this stuff. I'm like, why wouldn't I just cut it out and just see if it helps? And immediately it did. I started taking him to a homeopath who got him started on some stuff to kind of calm down his system, to calm down that reaction. Started him on supplements like omega-3s, DHA, EPAs, vitamin D, and got his immune system just back into homeostasis. And his behavior improved, his skin improved, his, bowel habits improved. Everything just got so much better. And that's when I was like, oh, there's so much more to this than just he'll grow out of it. It'll
Yeah.
be okay. So he was the big one that like really prompted this journey for me, because I had to also find out, I was breastfeeding. I had to find out, what it was that I was eating that was triggering him, plus what I was eating that was triggering me. So it was a big puzzle.
So with kids that are dealing with eczema,
Mhm.
what is the standard protocol for a pediatrician with that? So we've
Yeah.
talked to Dr. Tate, and we know she's naturopathic, and
Yep.
the clinic is primarily takes a naturopathic holistic approach on a lot of
Yep.
things without jumping straight to pharmaceuticals, which is exactly what you did with you said it was your son.
Mm-hmm.
What is the standard protocol with a pediatrician though? If I go to my pediatrician and say, hey, like son's got eczema all over his arm or
Mm-hmm.
whatever, face
Yeah.
gets flush,
Yeah.
what do they generally do?
They're generally doing topical stuff. So something that you can put on the skin or something that you can like bathe them in to calm the skin down. So like colloidal oatmeal baths, barrier creams, and then steroids to just calm down the symptoms. Because that's really what it is with kids with eczema is they're itching sometimes to the point that they bleed. It's causing disruption in sleep. And so they're really looking at symptom management and not the underlying kind of trigger and cause when you walk into the door for them. I think some practitioners may go a little deeper, like our pediatrician did the food allergy testing, which I appreciated. At the time I knew nothing about it. And so she looked at that, but generally it's topical relief and symptom relief.
Symptom.
Yeah.
And the other thing too that it has always made me question, I will be honest, I've been a bit of a skeptic when it comes to food allergy testing,
Okay.
only because sometimes I'm like, so we did some food allergy tests on one of my kids that had pretty bad eczema. His
Okay.
skin, it's weird. It's like it's changed through different phases of his life. He's
Mm-hmm.
now 13,
Mm-hmm.
but even just a couple years ago, it was probably the worst I'd ever seen it. He had a
Mm-hmm.
little bit as a kid. There were things that we knew certain foods would fire it off, but then
Yeah.
it would kind of be inconsistent.
Yeah.
And that inconsistency made me wonder, like, okay, well, if we do a food allergy test, it's just going to show us all the things he's always eating anyway. And
Right.
is it really the guy? So I have had some of those kind of a skeptic view of the food allergy testing,
Mm-hmm.
but because there's certain things on there, you're like, how do I remove all of these foods? Because if they're
Totally.
a 1 or whatever, and there's just a whole bunch of them, as a parent, that's really a hard thing to do, especially with the food choices that are available to us
Mm-hmm.
readily. Everything that shows up on that test is going to be things they're literally eating every single day. So it's
Some of it. Yeah.
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 Well, I mean, in my case, that was
Yeah.
the situation where
Yeah.
I'm like,
He's
the
eating
chicken,
blueberries every day. Yeah.
apples,
Yeah.
like what? Like these are,
Yeah.
he's
Because
just,
it's showing like sensitization. It's
Yeah.
showing like what they've been exposed to in some cases.
yeah.
And then but it depends on the like immunoglobulin that you're
Mhm.
using. But yes, that definitely can happen. And I do try to like preface that to people, like
Yep.
we're gonna see some things that they're eating all the time that may not be actual like true allergens. But the other thing that people take from that is, so they'll go to a doctor before and they'll say, have them cut out gluten, to help with the eczema. And they'll do it and they'll be like, okay, I saw like a little bit of a benefit, but not a lot. And then we do food allergy testing and wheat or gluten isn't on there. And
Hmm.
they're like, yes, he can have gluten again. And then they do it and it flares up.
Yep.
And it's because that food allergy testing isn't just like it's one piece of the puzzle. There can still be inflammation from a food that's not related to an actual allergy. It's related to their ability to break it down. What are the enzymes doing? It's related to how leaky is their gut, and
Mhm.
and is that thing coming in contact with, I always say it like, is it coming in contact with the blood vessel? It's not really, but there's different types of reactions. Food allergies is just one of them.
Mhm.
So it's a little bit more comprehensive. It's just one tool that we can
When
use.
we talk about gut health too,
Yeah.
it's really at least some of the research I've done and following Dr. Mark Hyman and some of the stuff that he's done, because he's really big on like these gut resets.
Hmm.
And that's what got me wondering, like with these food allergy tests, is that I don't know that it's all about saying, oh, these are the things I'm sensitive to, I can never have them again the rest of my life.
Right.
I think a lot of it has to do with being able to reset your gut in a way that you remove all that inflammation. Because then you brought up
Correct.
leaky gut. It's not really
Correct.
a syndrome. At least that's what Mark Hyman said. It's like,
Hmm.
it's not really like an actual syndrome. It's something that happens when you keep it inflamed for so long. Then
100%.
you get leaky gut,
Yep.
but it can be repaired, especially with how quickly the gut can turn over.
Yep.
The cellular turnover in the gut is rapid. So you
Super
can actually
fast.
fix it pretty quick. It
Super
might
fast.
take, your gut might turn over every 24 to 48 hours or something
Hmm.
like that. It could take weeks to actually repair the inflammation
Yep.
once once you allow it to do that.
Yep.
And then you can start to reintroduce some of these foods,
Yep.
and you might not have the same inflammatory response because your gut is healthy enough to handle it at that point. But I think the problem is that when we throw inflammatory foods into an already inflamed gut system,
Hmm.
that's where you're going to probably have the biggest problems, right?
Yes. And the other thing that people will notice, so we generally tell people cut these foods out for like 8 weeks. That's it. 8 weeks. We give them some stuff to like really heal that gut lining, like L-glutamine, marshmallow root, slippery elm,
Hmm.
aloe vera, stuff like that to like really heal it up. And then they'll put some foods back in and they'll be like, I didn't even realize that I was reacting to it until I put it back in. And now I can like really tell it's not the same that they were going through, but they're like, yeah, I felt bloated. And so it helps them to actually recognize my body doesn't feel good when I eat that, but I didn't even know before
Mm-hmm.
because it was you basically just reacting to like everything before. So it's an interesting like diagnostic and therapeutic type test to like take those things out and then start reintroducing them. But you're right, like the gut heals very, very fast. And food allergy testing is sometimes a way to just say like, how leaky is the gut? I will describe it to people like if you knocked your elbow on a table and then you get that swelling and bruising and it gets puffy and the skin gets really like taut and tight. That's kind of what's happening with inflammation in the gut. The cells should be like close together like this. And when it gets inflamed, it's like it just gets bigger and bigger to where those cells can't stay close anymore. They get like spread apart. And that's where the like leaky part comes from because now you've got these gaps in between and you can think about it like getting food stuck in your teeth.
Mm.
So like food comes in and right below that cell layer is like the blood vessels or stuff that food's not supposed to be like really coming in contact with, and that's where you get that reactivity.
Mm.
So the goal is to take out the things that are inflaming the gut and allow that to heal up so that you can get proper absorption of all of your fats, proteins, vitamins, all of that kind of stuff. Because going back to eczema, that's a lot of what it is these kids have this inflammation in their gut, this leaky gut, and they can't fully break down and absorb all of the nutrients. So, eczema is oftentimes a skin barrier issue. They don't have the fats in their diet. Either they're not getting them or they're not assimilating them, breaking them down, and putting them where they need to go.
Mm-hmm.
And so that's why we check gut health. I usually will check food allergies and gut health together with like a tiny health test for kids to really see like how are the two playing together
Mm-hmm.
and what do we need to be adding into the diet, taking out of the diet, because it's not always about just taking it out. Sometimes it is about replacing. So you mentioned Mark Hyman. I think he practices kind of the gut reset in the same way that we do, which is like a 5R approach or 5R approach. And the first one is remove. And so you remove all of the insults to the gut. You remove the allergens. You try to remove the toxic inputs that are coming in so that it can start to heal just by not being bothered, right? So it's not like you're not constantly, it's like having a tooth that's like, I don't know, jagged or something, and it keeps rubbing on your gums. If you get that tooth filed down, then the gum can heal because it's not constantly rubbing on it. So that's kind of the approach. Like you just want to take that stuff out so the gut can just like have a breather, just chill, right? And it can then start to absorb more things. This is not as often, I don't have to do this as much with kids, but a lot with adults. The second step is like replace. So we have to give back to the body what is being depleted. This is mostly an approach I use with people who have chronic stress. And that's like everybody these days. You have to give back all of those nutrients, vitamins, minerals, the parasympathetic input, right? You're removing this, you have to remove the sympathetic input and put the parasympathetic back in to calm the system all down. Give it some digestive enzymes sometimes, because when we're in that sympathetic state, and kids are in that sympathetic state too, right? When we're in that sympathetic state, you're not digesting. So you don't have the stomach acid where it needs to be. You don't have all of the pancreatic enzymes and digestive enzymes where they need to be. So sometimes we have to put those back in so they can actually break down their food, and then they're absorbing it in this nicely, healed up gut that they have from just taking all of that stuff out. So those are like the first two steps of everything. And then it gets more nuanced with like, how do you reinoculate? How do you repair? And then how do you continue to rebalance? But it's the same kind of approach that like Mark Hyman and a lot of the big functional medicine names do. That's exactly how we approach it as well.
And then as you get older too, I know we've been talking a lot about like children, but I got to imagine that our systems change a bit as we go through adolescence and into adulthood. For me, I've never been sensitive to any foods to my knowledge, but I'm starting to wonder now. I'm in my 40s and I'm like, there's been certain like skin responses where I'm like, is this, environmental allergen related? Is it, I have had some seasonal allergies,
Okay.
not extreme.
Yeah.
Or could it be food related? Do you see adults that start to get sensitive to certain foods or allergies later as they get older that they didn't have when they were younger?
Yeah. And I think a big part of that is cellular health and cellular kind of like degradation. And that goes into like their metabolic health as well. So if you have cells that are not functioning properly, like let's say just a nutrient can't get into the cell because that the layer around it doesn't have the right charge. It's not allowing things in and out the way that it used to, or the mechanisms inside the cell aren't really working the way that they need to, and you're pulling more resources to try to like make the same processes happen, then you're taking resources away from other areas. And so then you get sometimes this dysregulation in the immune system, or with histamine responses. And so to me it's more about like, what is the cellular health of that person, and how can we improve all of that to stabilize some systems, stabilize the histamine release, the mast cells, the digestive system. What does stress look like? Because as a 43-year-old guy, you're probably in a different stress state than
I'm
you
not
were.
43.
42. I'm so sorry.
Don't tack on an extra
I'm so
year.
sorry. I'm not 40 yet. So everybody that's older than me is
I'm just kidding.
You might
It's
as well be
fine.
50, Colby.
I know. I have to look.
42.
I'm deep into my 40s. Anyway, sorry, didn't mean to cut you.
You're gonna be okay.
Okay, I'll be fine.
You're gonna be okay. We're gonna get those sentient, those cells out of
Yeah.
you. Not sentient. What is the word I'm looking for? Those old cells.
Just get those old cells.
Just get them out.
Yeah.
We just need to clear them out.
Yeah.
Right. But you're in a different stress state than you were when you were 20. Right. Because a lot of your cells are just older now. And it happens to all of us. And we need to be focusing on repairing them and giving them more of the nutrients that we need. You're also, I mean, you're very active. A lot of people are, even into their 40s, 50s, 60s, still incredibly active. and utilizing a lot of resources, fats and proteins and micronutrients and things like that. But many people aren't as active as they used to be. And so they don't require the same inputs that they used to.
Hmm.
And even with the same level of activity, or even probably potentially a higher level of activity than you had when you were 20 years old, you still require different inputs. Your body isn't going to be utilizing carbohydrates and sugars in the same way that it did, because it just doesn't have that capacity, right?
Mm-hmm.
And so the needs and the input needs change as we age as well, from kids to adolescence to adulthood. So everything, all of that shifts.
So one thing and I don't know if this is part of why we test for this, but I know that over at Dose, you do a lot of these immunotherapy allergen type tests.
Mm-hmm.
One in which that it seems that most insurances will actually cover for an individual. But if someone's dealing with onset of, allergic responses to things, whether it's seasonal or ongoing or food related, you basically take these samples and you're able to send them out and they can create a custom immunotherapy
Mm-hmm.
treatment of serums for the individual.
Yep.
What exactly are those doing? And is this related to, like, in my case, for instance, or is
Yeah.
this completely different where if I'm feeling I get some, allergic response or whatever to something, I don't know where it's coming from. Is that what this test is supposed to help identify, or how do those
So
work?
so immunotherapy for the seasonal allergies is really just it's similar to like a homeopathy, where you're basically giving the system this tiny amount of what you're allergic to, like super diluted down, and it's allowing your system to understand that input, to understand the stimulus and not react to it as aggressively as it did. It's basically telling your system like, this is okay,
Hmm.
and you don't have to have this crazy reaction to it anymore. And so it like steps up, so it gives you this like ultra diluted version of it, and then the next step is a little less diluted, and then so on and so forth. So you do like 4 rounds of that. So it's really just trying to give information to the immune system so that it doesn't react as aggressively. That's what the immunotherapy does. Does it change the cellular makeup that you have, or the status of your cells, or what's actually, happening in other areas of your immune system? No. It's just giving it information. And so there's still work that needs to be done aside from giving the immunotherapy. That's symptomatic treatment. It's not cellular treatment. It's
Right.
not repair. It's
Mm-hmm.
just information so that the body kind of chills out.
That makes sense.
Yeah.
So would you say cellular treatment then, metabolic treatment, would start in the gut? Or could it be a lot of different places?
It
Like
can
where
be a lot of different places. I know there's a lot of practitioners that say like it all starts in the gut. I don't think so. I think it all starts with more inflammation and toxin exposure. And that's where that first like spark of inflammation starts coming from, and then it spreads, right? The gut is a really great place to start, because that's where all of that input is coming from. You're getting, food is information for the gut. And if that food is filled with chemicals and artificial flavors and all of that that the gut doesn't recognize, and that the immune system in the gut, the galt cells, if they don't recognize that, they see it as foreign, they react to it. And that's what can start to, you know, brew these underlying like autoimmune diseases, because you have tonsils and like all these little patches throughout the gut. It's all immune tissue. And it's so that you're not ingesting toxins, or so that your body knows immediately when you've done it and can come to the rescue and can start like putting things, where they're supposed to be, to like clean up the mess. So the gut is a nice place to start, because it's where nearly all of that kind of toxic load comes through, as well as the skin. Those are like the 2 big ones. And so it's a nice starting point, but it's not the only starting point, right? There's cells all throughout your body, in the joints, in the brain. All of those are being affected by the toxic load that we have, and they're all operating, inefficiently because of that. So the gut's a nice place to start, but it's not the only place to start. So I look at like, you got to look at the cell. Like if we can, I would be great to just like put a picture of a cell up right now. You have to give the body what it needs to create and maintain and repair every cell in your body. And they're all pretty much the same. There's a lipid bilayer. So we have to have good fats, right? That shuttles things in and out. If a cell doesn't have an efficient and clean kept and like fully charged up lipid bilayer, phospholipid bilayer, it cannot allow things to come through. That's like it maintains the electric charge of the cell. And so if that is damaged, nothing is signaling right. And then you have everything on the inside of the cell. The big word right now is mitochondria. Everyone's all about mitochondria, the powerhouse of the cell. And it's a huge part of cellular health because it's where all of the energy comes from. ATP, all of that stuff happens in the mitochondria. And so we have to give the cell all of the resources to function properly. And that's going to be healthy fats, proteins, good mineral balance, trace minerals. A lot of people forget trace minerals and the ratios of all of those things. And so there's a lot of like specialty labs that can be done to look at the real like ratios of those, but a lot of it is just empiric treatment. You know, one of the big things that I think people are missing in their diets that leads to inflammation, metabolic disease, autoimmune issues, gut inflammation, all of that is healthy fats. Like if people could be eating, wild caught, flash frozen, or fresh fish 3 times a week, or even more than that, we would have such better metabolism and much lower rates of autoimmune disease and metabolic disease. I mean, hands down, if I could just tell everybody, you're getting a subscription to, this wild Alaskan or like Icelandic fish company, I would prescribe that to everybody if I could.
What would be an
100%.
alternative to that if you hate fish?
If you hate
Yeah,
fish.
if you just can't stand fish, there's a lot of
Colby.
not. I'm not one of them. I
Okay.
love fish, but
Okay.
I know
I
people
know.
very near and dear to me that cannot stand to be even around me if I'm eating fish.
I know.
We're
I
talking about my
know.
wife.
Steph.
Yeah, I know.
We need fish.
She won't eat fish. Won't get close to it. So
Yeah.
what would be some alternatives to that if you're not a fish eater?
Fish oils. I mean, a really good fish oil. The problem though with fish oils, and people are all about it. They're like, I'm just gonna do fish oils. I'm gonna go with that because I don't like fish. The problem with that is that some of them can be rancid because of the way that they're made, the way they're processed. So cold pressed fish oils is going to be the way to go. A lot of people are like cod liver oil. That's the one. That's different from a fish oil. So there's in a fish oil that we're talking about, or like an omega-3, omega-6 type of complex, we're talking about like EPA, DHA in certain combinations. GLA is a really good one for like neuroinflammation. And then the parent oils, you're going to find more in like flaxseed and stuff like that. In a cod liver oil, that's more, you're getting it from like literally the liver. So it's more like vitamin A, vitamin D, like fat soluble vitamins. So a really good fish oil is an alternative to eating daily fish. But you have to make sure that it's processed properly and that it's created properly and that it's not rancid. Because if it's rancid, you might as well just be, drinking volatile seed oils at that point. Because it's going to change the omega-6 to omega-3 profile, the ratios there, where you want more omega-3s than you do omega-6s. So it's a good alternative as long as you're getting a good product.
Yep.
So that would be, and for kids, they're not going to eat fish 3 times a week. Very rarely do I have a kid come in that the parent is like, yeah, they'll eat fish all the time. They love it. So I put them on a certain ratio of, DHA to an EPA, depending on what I'm treating, and some of those other fatty acids to go in there.
So outside of nutrition, like I guess the goal in the longevity space is to keep that cellular function optimal as long as possible. Because as I get older and, once I hit 43,
50 basically.
Yeah, it's we want to keep like those mitochondrial factories just like firing on all cylinders
Yeah.
and trying to keep healthy cells running through our bodies.
Yep.
So outside of really solid nutrition,
Hmm.
are there any other therapeutic things, whether it's through pharmaceuticals, peptides, other things that we can be doing
Yeah.
to try to put ourselves in the best spot possible
Hmm.
to preserve the integrity of our cells?
Yeah. So the idea there is you want to be giving the building blocks or the precursors to the things that will carry through or carry out detoxification in the liver, that will increase your ATP and NAD in the cells and things like that. So NAD is a big one that a lot of the pharmacies are putting out right now. NAD plus. That is like the end product of the cellular energy. But taking exogenous NAD is not actually proven to improve your NAD over time. It's just like taking exogenous testosterone. You're not actually increasing your body's own ability to create testosterone for you. You're just giving it to it. It's at that point, it's symptom management. And so taking the precursors to NAD, I think is a better long-term plan that gives your body the building blocks that it needs. So that would be things like NMN or NR. Those are the precursors to NAD. There's a few other things that I love to add in, and they're touted, I think, more for like, well, at least berberine. Berberine's one of my favorites. Berberine is touted as like the natural metformin for like diabetes, but it does so much more. It helps to increase the cellular energy in the cell. So something like berberine and resveratrol, those are two that I love to give for cellular health. And then we have to remember about detoxification, because you can have like great cellular health going on, but if you can't like break things down, detoxify and filter them out, then they just get recycled and build up, and then you've got, you know, it's bad, sludgy stuff. So glycine, cysteine, amino acids that are going to help the liver to do its methylation processes and that are going to help build glutathione, to which glutathione is like your master antioxidant. That's the one that goes around and cleans up all of the oxidative stress and free radicals and all of that stuff, cleans it up and gets rid of it for you. Most people are very depleted in glutathione, and the two things that are doing that, alcohol and Tylenol.
Mm.
Huge. So when you're giving your kid Tylenol, this just soapbox, when you're giving your kid Tylenol for a fever, you are literally taking away their ability to fight that infection and clean up the mess that inflammation and that virus is wreaking, you know, on their body. And so Tylenol is not the way to go
Hmm.
because it just really depletes that stuff. So, but back to what I was saying, we want to be giving those building blocks, right? And the macronutrients and trace minerals and macro minerals, those are also building blocks. We have to give those the resources, because when we're in a state of chronic inflammation, you're pulling resources from things that like you don't need. So like your hair. Why do people hair fall out when they're stressed? Because you don't need hair to survive, right? Why do we get joint pain when we're in a chronic stress or chronic inflammatory state? Because we don't really need to replenish that collagen and that connective tissue and, you know, that synovial fluid to survive. So we pull resources from there and we shunt it to where we need the resources, like the immune system to put out all those fires, or just the organs so that they can function properly. But we pull resources from there, and that's when we end up with these like really kind of constitutional vague symptoms that you're like, why is this happening to me? And so we do need to replenish that and not forget that is a really huge piece of the puzzle to make sure that the cells are working properly. And sunshine. Sunshine. The freest thing that you can get, getting your body outside and getting sunshine, It's not always going to be synthesizing vitamin D, but it is activating different photoreceptors. It's keeping eye health, brain health, nerve health, skin health. It's giving you so much more than just vitamin D. People get a little fixated on the vitamin D part of it, but there's so much more that the sun gives us. It's like another food group, you know.
Well, it helps with
So,
like your circadian rhythm a
oh,
lot too, right? I
absolutely.
mean, as far as like we know how paramount sleep is
Yeah.
with all of our hormone function, hormone regulation,
Mhm.
probably mitochondrial function, everything really
Mhm.
relies on how well we sleep. And so just being able to go outside and get some sunlight in the morning, maybe even in the evening, how well that helps regulate
Right.
your sleep cycles is
Right.
huge.
I mean, it's morning sunshine within like 10 to 15 minutes of sunrise, like straight in the eyeballs, that actually determines how much melatonin you're going to make at night
Mhm.
and determines what your hormone signaling is going to be like through the day, through the month. It's it does so much more. That input from the sun does so much more than anybody even realizes and gives it credit for, because the sun is demonized, you know. And this is coming from a melanoma survivor. I had melanoma 10 years ago. And it was deep. And obviously, you know, I go to my dermatologist and they're like, you know, sunblock all the time, you know, every minute of every day. And I still have a lot of people, you know, family included, really close friends that are like, Kasey, what are you doing? Why don't you have sunblock on? I'm like, because sun is not the problem. It was my diet 10 years ago. It was my level of inflammation. It was the amount of alcohol I drank. It was all these other factors that put me in a terribly inflamed state that then gave my body the opportunity to, you know, not repair itself properly
Hmm.
and to create a cancer cell. And so I'm like, I'm big in the sun. I don't go to tanning beds, but
When we say
you know,
when we say the sun, it's not it's different times too. I mean, there's
yeah,
three different types of light. You've got
yep,
well, there's probably more than that, but just in general, you have the morning like blue light, right?
mm-hmm,
Then you've got white light midday, and then you
mm-hmm.
have red light. And we talk about blue light therapy, red light therapy. We're not talking about sitting out at the hottest, highest UV time of the day. You're
Correct,
not going to get
correct.
when you're talking about the first 15 minutes of sunlight,
Yeah,
no one's getting burned at that time.
nope,
Um,
nope.
of course, here in Arizona, you got to be up at like 4 a.m. in the summertime to do this, but you know, it's free. It's free blue light and red light therapy, and
100%.
it's hard to do. I mean, it's like to work your schedule around it. Sometimes we work or whatever, we're inside, and but it is kind of one of those free biohacks that I think is pretty cool.
Totally, totally.
Um, but going back to a couple things, I mean, you mentioned a bunch of good supplements there. The precursors to NAD would be NR and NMN, which I
Mm-hmm.
also, and I have seen some people that actually feel more energy when you're talking about symptomatic things with NAD plus injections.
Yeah.
Some people actually do better on an NMN from just even a symptomatic standpoint than they do
Yes.
with an injection. Some
Yes.
people swear by the injections, and it's maybe not solving the whole problem, kind of to your point of comparing it to testosterone,
Mm-hmm.
but symptomatically, it has helped a lot of people with depleted energy and some other things too.
Totally.
But you had also mentioned glutathione. What are your thoughts on if we're depleted in glutathione generally,
Mm-hmm.
and there's things that alcohol, Tylenol, things that make it even worse, especially in kids. But what are your thoughts on glutathione injections in helping boost our body's master antioxidant?
So some people have the same kind of reaction that you were talking about. So sometimes glutathione can be too much for certain people because it's an end product, and they do better with the precursors. So it depends on the person. Sometimes you have to give them just the NAC, N-acetylcysteine, as the precursor, and they do a lot better on that. I still love to use NAD and glutathione to help people. I still do symptom management, right? People come in, they're like, I am so sick of feeling terrible. I just want to feel better right now. And I'm like, cool. NAD for you for like, you know, the next 6 months. Let's do it. Let's get you feeling better so that you can function and you can do all of the other things. Some people come in, and this is for glutathione too. Some people come in and they're so inflamed and they're so tired and they're so depleted. And they're like, Kasey, you're telling me to work out? Like, I can't find the time, the energy. I come home from work and I just want to lay on my couch. I'm not nice to my kids. this is also me. Like I feel that way sometimes. And they're like, I just want something that's going to help me quickly. And I'm willing to do the work on the back end too. And that's where things like NAD plus right away, like let's just fire it in, but we're going to do the work on the back end as well.
Mhm.
Glutathione, like I said, I usually start people with like an oral glutathione because I think injections can be really aggressive for some people. It'll end up giving some people diarrhea, or I did have one patient that came in with a Herxheimer reaction. Have you ever heard of that?
Mm-mm.
It's basically where you get like intracellular detox, like to the max, and then you get these detox symptoms.
Mm.
And so you feel even more fatigued, even more tired, like things just get really, really bad because you have so much intracellular uh, toxins that then they get released into the body and you just feel terrible. So you do have to be careful with that. If you suspect that somebody has a really high toxic load, glutathione may not always be the best one because you might just open the floodgates and make them feel even worse, and then they're going to be like, I'm never doing anything like that again. So starting with a precursor is sometimes a lot better. But there are people that just come in and they're like, I just feel like my allergies are really bad, or, I'm always getting sick. I'm just feeling a little bit depleted. And you're not as worried about their toxic load. I mean, we all have a toxic load, but you're not as concerned about that. Then I think glutathione is great. I think people don't like it because it hurts.
Mm. It's not that bad.
Isn't it? I don't think it's that bad. I got sick of it for a while. I was like, okay, I'm sick of my
It stings a little bit in the
booty
moment.
hurting. Yeah.
Yeah, it stings
Yeah.
a little bit in the moment, but um and and I wonder too if it's a dosing issue, if people get over like an overwhelming sense of toxic
Mhm.
load. But at the
Mhm.
same time, would that not be, I mean, yes, it makes you feel uncomfortable maybe for a bit, but if is it not helping flush the toxins out at that point though? So
Oh,
wouldn't that
100%.
totally help them if they suffer through kind of that?
Yeah, so but what you need to do in that kind of a scenario is you need to add a binder. So if you are concerned that somebody has a high toxic load and you give them glutathione, you have to give them something that's going to bind that up. Whether that is going to be like a citrus pectin or like a combination of, charcoal, bentonite clay, zeolite, but some of the other kind of binders that can like really grab that stuff and pull it out so that they don't get as much of a reaction. And I've
Mhm.
learned that the hard way, in starting, this practice for myself, that you need to add those things in if you're concerned about it. And really, you might as well just add it in anyway, when if you're doing glutathione, just to grab that stuff and get it out, because you can't assume that everybody is going to be able to flush out all of those toxins. Are they pooping every day? Are their kidneys working really well? Sometimes giving them that little extra boost is kind of the way to go.
Yeah.
Yeah.
And sweating it out too, right? I mean, that's a big
Yes.
part of it is I think people
Yes.
don't sweat enough, and
No,
whether you just go sit in a sauna.
I need to go sweat.
Yeah. Yeah. Um,
Yeah, that's a big part of detox that people forget. And lymphatic drainage too is
yeah.
another one that people forget about.
Oh, this is an interesting conversation. It's not really where I was planning on going with it, but that's what happens when you make plans.
Let's
Things
go.
change.
I mean, we can go back to whatever you want.
No, there's honestly, we can do another episode about lots of stuff. There's just so much here.
Yeah.
I think at the end of the day, a lot of us are just trying to stay optimal. And I
Yeah.
think trying to be more proactive. And I think people get really confused how to be proactive because there's a lot of noise out there.
Yeah.
There's a lot of conflicting information, or you got this person that says you need to do this. And then you see a lot of like these super jacked, ripped gym ladies out there that are ripped and they look good, but it's also like, is that healthy? It's
Mhm.
like, is that really optimal? Like
Mhm.
you actually look like you're about to have a heart attack. So I think most of us sit in the middle somewhere where it's like, hey, we want to look good, but we want to
Or
feel good.
feel
And I want to
good.
I don't care to live forever, but while I'm alive, I want to feel really good.
Yeah.
That kind of the health span piece
Yeah.
of it. And so when I look at, you know, trying to always like detox and there's a lot of the natural things we can do and sweating and all that. But I think, okay, can I use a glutathione and help to constantly like stay in a detox state,
Mhm.
or like to the cellular piece of it, like how
Mhm.
can I put myself in the best chance possible to make sure that my cells are turning over properly and that they're constantly healthy.
Mhm.
And I think that's kind of the biggest question mark for a lot of people, especially kind of in this like 30 to 55, 60, where there's
Yeah.
just a lot of change for a lot of us. There's a lot of hormonal changes going on.
Mhm.
You're kind of in that perimenopause state for women, and there's a lot of changes going on there.
Yeah.
And so I think people are just trying to figure out, okay, how can I just like smooth out a lot of these like massive symptoms that you start to feel,
Yeah.
whether it's through lifestyle or through, potential pharmaceutical therapeutics that are out there. Um, and peptides are super interesting too. We talk about those all the time, but um, outside of that, I like, what would be the starting point for people? I think there's just a lot of people that are hesitant, or I get a lot of questions too. They're just like, hey, like, what do you take? Like, that's the first question. And I'm like, well, it doesn't matter what I take.
Yeah. It's
Really,
personalized. It's
that's my
personalized to
response.
you.
It's like,
Yeah.
it doesn't matter, like, what supplements do you take? What do the, and I always kind of come back to the same starting point of, when was the last time you kind of took a look under the hood and you got your labs checked?
Yes.
And it tends to be a massive starting point.
Mhm.
Just curious, in your opinion, like, why are people hesitant to just go get their labs done?
So, I actually think this is one thing that conventional medicine got right is going in for your annual checkup, getting your labs done, getting a baseline, seeing where everything is. I think that there's probably several reasons why people are hesitant to do that. Number one is because they're like, well, I'm fine. I feel fine. I don't need to go to a doctor to tell me that I feel fine. I just want to, do this stuff on my own. I don't need to see like all this stuff. That could be one of them. Number two, health anxiety. So people being afraid to know what's going on, or being afraid to kind of confront that or admit that like maybe they don't feel as great as they once did, or that they want to, and that they have to actually work on that. I think those are two good reasons. Another reason is just because it can feel daunting, to go into a doctor and they're like, okay, we got to get all these labs done. Okay, you're a woman, you're over 40, you need a mammogram. Okay, you're, a man, we got to make sure we're checking your prostate. Like, there's a lot that conventional medicine puts on you for preventative screening, especially based on like your family history or your personal history. And so it can feel like a lot. And you're like, dude, I just wanted to know what I could take to like, build my muscles, like
Mhm.
whatever it is. So conventional medicine puts a lot of other stuff on you. When we have people come in to dose, um, generally they're coming in with some sort of symptom that's been there for a while, whether that's 6 months, a couple of years, it's been building, whatever it is, there's usually something there. Very rarely do I have someone come in and they're like, I feel great. I'm doing all the things I want to do, and I just want to, get a baseline, know where I am so that I can check again in a year, or I know, what I'm dealing with, how to optimize stuff. I love that. I love when people come in to do that. I wish more people would do that and just say, look, you take your car in every 6 months or 3 months, or clearly I don't take my car in that much, but but you do that, right? You take your kids in for their annual checkups. Why are you not doing it for yourself? Right? You can't do anything for your children, for your family, for your work if you aren't optimized. And you take your kids in for their well checks even though they feel well, because that's what your doctors told you to do. It's no different. It's not like, yeah, insurance companies are, trying to get your money and all of that kind of stuff, but you know, at the end of the day, every practitioner really does care about people. And that's what these programs, like, the American Academy of Pediatrics, that they care about kids. They want to see them. They want to catch stuff early. And you should want to catch stuff early too, right?
Hmm.
Everybody should come in, or not even catch stuff early. Just know where you stand. Where's your baseline? Where's something that you can tweak to make sure that you feel this good 5 years from now, right?
Yeah.
So if you're talking to people, that's what I would say. Like, dude, you feel good now. But what about, 5 years from now? Do you want to feel this good in 5 years, or do you want it to go down? That's a reason to get in and just get baseline markers to see what's appropriate for you. What support do you need long term? Because the world around us is kind of like sets us up for metabolic failure, and it shuts our bodies down fast because of all the toxins. So what can you be giving your body to support it, just to like make it through a day of, pollution and whatever artificial stuff is in this food or that? How can you just, optimize yourself with that? That's how I would approach it. And that's what I tell people when they come in to see me, is like, I just want to give you all the building blocks to keep feeling good, or to get you feeling good and then maintain that long term. And that's going to shift and change over time based on, stress levels, work, relationships, all of that. It's always going to, there's going to be these highs and lows and waves and new patterns and things like that, depending on what's happening in life. So that would be my reason for, having people come in, is just see where you are and give yourself the same treatment that you give everything else in your life.
Yep.
Like your car.
Yeah, I think we I don't know, there's a lot here, but I think just as a society, we're so busy. Everyone's just like, I'll get to it when I can get to it. It's not convenient. There's a lot of that part of it too. But I think you just brought up something I hadn't really thought about. I think with our kids and even the school systems, they want like their wellness checks and stuff to be done, and they get on the schedule with kids, and you just kind of stick to it because that's kind of how we've done it forever. And so our kids are always getting checkups. They're always being seen. They're mapping out their growth. They're checking so much stuff. But then as we become adults, now it's on us to just choose when we want to like go get checked out.
Right.
And some people are much better about getting annual physicals than others. But when you're a kid and you're in sports, my kids have to go get annual physicals or else they can't play on the high school soccer team. Right. Like it's ingrained in the system that way.
Right.
But for us as adults, you either have like a really good corporate benefit that helps you go get that done with a company, or you just have to go out of your way and pay for it. And it's just kind of in the way. It might be uncomfortable. I don't want to pay for it, whatever.
Yeah.
But to your point, it's like we take care of our cars because we don't want them to break down, because we don't want to pay for it.
Right.
Well, if you think you're not going to pay for your health later, you're absolutely wrong.
You totally are.
And, and so, yeah, I'm kind of more in the camp of just trying to stay ahead of it and making an investment now in your health so that we're not reactionary down the road. But we tend to just be that way in general. I mean, if all of a sudden, and I'm guilty of it in so many different ways. I remember I used to work in Houston, and for those that know Houston well, downtown, there's a whole underground tunnel system that connects all the buildings under Houston. There's restaurants down there. Like you can get your haircut down there.
Just like a different city.
It's a city underground,
under the
because
city.
it's just hot and humid during the day.
Yeah.
And so many of the companies are connected, and you're going between buildings for business meetings and stuff. They're all connected.
Okay.
And I was just eating an apple or something one day and literally split a molar in half. Well, in that moment, you better believe nothing mattered in that moment.
Call the dentist right then.
I didn't even call a dentist. I went down to the tunnels and I found a dentist that was down there, and I just said, I need you to help, because it was so uncomfortable and it hurt so bad, and there was nothing I could do because it was split.
Yeah.
And I was just like, before I can actually get into my dentist, is there a way you can just glue this together? Because it didn't fall out, it just split.
Yeah.
And it's kind of the same concept. I think a lot of times we have a broken arm, we run to the ER, we finally have some massive health issue, and then now all of a sudden it becomes urgent, right?
Yeah.
And I want to try to avoid the urgency and just be ahead of it. And to your point, like the physicals and all that are good, but I don't think they're good enough personally, only because as an adult, I was getting physicals done every year because I had a good corporate benefit at the time that they had this program, and it was awesome. I think I've talked about it before, but the problem is that generally your insurance is pretty limited on what they're going to cover with lab work. And so most people are getting that baseline, but the baseline is a basic metabolic panel, which covers a decent amount of stuff,
Mm-hmm.
but it's never going to check your hormones, probably not checking your thyroid. It's
Mm-hmm.
probably not checking a whole lot of other things in there that I know that you do
Mm-hmm.
at dose and that we all do. And so like you have these comprehensive panels now that are accessible that show you so much more as a true baseline.
Mm-hmm.
In my instance, the reason why I thought it was really weird is I was getting my labs done same place every year. I'd go for a decade. I went to the same place. They'd do the whole screening. It was like this whole thing that they did. And at the end of it was like a 4-hour deal. Get your labs drawn in the morning and you'd review them after you went through all these other
Oh,
things.
wow.
You'd review them with
That's
the
cool.
provider 4 hours later.
Yeah.
And I remember asking him, I was like, finally at a point, I remember some of my older friends were starting to talk about testosterone, and I was just, I felt like I was healthy and I was active and I worked out, and, I didn't necessarily think there was anything wrong, but I
Right.
was just kind of curious. I
Yeah.
was like, so I asked him, I said, hey, can you tell from my labs, like how my testosterone is? He just looked at me. He said, oh, we don't test for it, but you're fine. Like, I can tell you're good. That was his response to me, just because I was maybe a little younger. I looked athletic.
Yeah.
I was healthy generally. I had, muscle or whatever.
Yeah.
And so that was just kind of the response I got
Yeah.
was, you don't need it checked because you look fine. I mean, I wasn't like
Oh,
necessarily
no.
symptomatic or anything,
Yeah.
and maybe I didn't, but I had no baseline.
But you have a right to know
But I
your
have,
baseline.
but I have no
It's
baseline,
your
right?
body. Yeah.
But what was wild is a baseline today is so much different than a generation prior.
Mm.
And I can say this only because I have a family member who got the first time they really had their testosterone checked was when they were in their 60s.
Mm-hmm.
His baseline testosterone was higher than the first time I got mine checked at 38.
Oh, 100%. My dad, same
I'm
way.
like,
Yeah.
why in the world?
Yeah.
And I still felt normal. Like, I
Mm-hmm.
didn't feel like I was symptomatic or anything, but like in the normal range. But his normal number was higher than mine.
Mm-hmm.
And he's like a whole generation ahead of me.
Mm-hmm.
And so I do think, going back to the environmental issues, the
Yeah.
toxins, the toxic overload that we're going through, it's real. Like, it full on is real.
And I think we touched on that in our last podcast we
Yeah.
did together, like the differences in like our parents' generation and our generation, and then
Yeah.
our kids.
Yeah.
Like there is a huge shift in the toxic load that we have
Yeah,
right
for
now.
sure.
But I want to go back to what you were saying about the comprehensive panels. So I work at Dose, right? I do functional medicine, but I also have another job. I do conventional, like by the book medicine for a lot of, underserved, underprivileged people that are on Medicaid, Medicare, where there's a lot of requirements,
Mhm.
right? They have to get their mammograms, colonoscopies. Like there's a way you have to do something, and it's very different from the way that I function in Dose. The panels of labs that I can get for them are actually pretty extensive, and insurance will pay for them. There's some things that they're not going to pay for, right? So if I want to get testosterone on a, female, I got to have a good reason to do that. But in general, I can get a pretty comprehensive, like micro and macronutrient or micronutrient, like vitamins and a good thyroid panel, a good cholesterol panel with like different risk stratification stuff in there. I can get all of that paid for if I have the right diagnosis codes. It's about the interpretation. That's, I think, where we really see a difference between conventional medicine at your regular physical and functional integrative, holistic medicine, is the interpretation of the labs. In a conventional realm, I'm not going to be able, if I see a TSH, this thyroid stimulating hormone, if my thyroid stimulating hormone on that lab is between 1 and 4, that insurance is not going to pay for me to look at the free active thyroid hormone because it's normal. Where then when we go to functional medicine or, self-pay, cash pay type stuff, you can get those things on a like reflex panel or just ordered without that TSH being abnormal, right? By the conventional standards. Because when we're looking at a TSH, our reference range is not 1 to 4. Our optimal range is like 1 to 2. So it's the interpretation of the lab that is different. Cholesterol, right? I look at cholesterol and the cutoff for total cholesterol is 200. You're above that, they need to be on a statin. They need to be on, aspirin. You need to be checking all of these other metabolic things. But what if their triglycerides are perfect
Mhm.
and they have protective HDL? Why can't their total cholesterol be up to 240? That's actually kind of where it needs to be for optimal brain health, as long as the ratios and the whole makeup of the profile is better. So I think it's more of a difference in interpretation. And so people will go in, this is where people get very turned off to conventional medicine or their regular PCP, is they'll go in and they'll say, I feel terrible. And they look at labs and they're like, everything's normal, because they're moving fast, right? It's a factory. They've got somebody in there every 15 minutes, every 5 minutes in some cases. I used to work when I was in head and neck surgery. We saw sometimes 60 patients a day.
Mm.
I mean, it's you're moving fast through these people. And so they're looking at a lab and they're looking for the high, low, high, low, high, low, high, low. If it doesn't say high, low, high, low, high, low, they're like, it's normal. Good. You're good. Everything's great. But meanwhile, their B12 is, 250, which is 1 point away from the low end of normal. And vitamin D is 31, which on there is normal, but is that really optimal for them to be, getting the melatonin production and the immune system support? It should be at a tighter range between like 50 and 70. So a lot of it is left up to the interpretation of the provider.
Yep.
And how well do they know those reference range, and where should the optimal range be?
Yep.
You know what I mean?
Totally. Yeah. Yeah. There's a lot there. One thing that we've tried to do at HEVA is empower the individual to be able to do a lot themselves.
Mm-hmm.
But if you look at like lab work and interpretation of lab work and treating somebody, you get into like potential thyroid dysfunction, or, other traditional hormones, testosterone, estrogen, all that kind of stuff. Like really treating someone's an art. It's not just you're in the normal range.
Yep.
Even within the normal range, trying to get them to not be symptomatic is so unique to an individual
100%.
that it takes a lot. It takes time. It takes more than a 15-minute consultation.
Yes.
It could take several months of these consultations to get it really dialed in.
Yeah.
And then it starts to shift and evolve even as we change too. So there's that piece of it. But one thing that we did at HEVA, at least for people that are kind of like on the go and want to get a look at what's more of an optimal level than just what's normal,
Mm-hmm.
is with all of our labs, we partnered with a functional medicine doctor, created a functional report that we extract your labs and we throw them into a functional report. And so based off of your age and gender, it doesn't just say what's on the normal range. It gives you an optimal range. It gives you an optimal reference.
I love that.
And so we provide that for free for anyone that gets their labs with us, which is kind of cool.
That's great.
So at least you can have something with you too.
Yeah.
And you can take that and say, okay, well, I have my labs. Now I want to go talk to my doctor. And you don't have to like work with our doctors. Like you could get your labs with us and go take them to your doctor and say, like, at least it empowers the individual to know a little bit more about themselves as well. And say, look, I know that I know I'm in the normal range, but this is where I would be optimal.
Right.
And I feel off. Like I have all these symptoms.
I want to get
Let's talk about that.
Yeah. I want to move that dial.
So I
and
think
that's great, because a lot of times I'm like, hey, it's okay. Like it says this is high, but actually like that's a good number that we like. Or this says like normal, but it's not really where I want. So I'm like marking up the papers and I'm like not optimal. Like, so I love that.
Well, I'll get you a
that.
report so you can see it, and you can like use it with like your patients as well. To walk them through and show them that.
That's
too.
great.
But it's good to empower people a little bit. I think there has been this asymmetric information sharing with doctors, and sometimes we just go in and we trust like they know exactly how to help us. They prescribe something, we take it, we think we're doing better, and now you've got a parent that's on 15 prescription medications. It's like, what?
Right.
And this is what I'm seeing in my family and with extended family, is the over prescribing of so much stuff, because no one questions it. It's just like you just trust the doctor, and in most cases I think the doctors truly want to help people. But I just want to be put in a position where someone can provide me the information and I can do a little bit of research on my own.
Yeah.
And really, AI is great. Like for this, there's a lot of good information there. I know some people are going to try to self-diagnose, which can be a little bit dangerous, but to be able to do some research by yourself and to be able to get a detailed report about yourself, at least you're equipped to have the conversation with your doctor.
Oh yeah.
And figure out what's mutually like what's best. Cause I've had to
Right.
challenge providers in the past because I know myself better than they know me,
100%.
sometimes I think we
Yeah.
throw it all over to the provider and
Right.
just say, just fix me.
Just tell me what I got to do,
But
doc. Yeah.
it's a
Yeah.
two-way street, I think.
Yeah. 100%.
Anyway, I think we're past time here. I think we've been going.
We're right
We've been
there.
chit-chatting.
We were just having fun.
All right. Well, we got to do this again because I have more stuff. I get a lot of questions from parents about their kids, and I get questions about individuals, about themselves, and what they should be doing. And I would love to just maybe do a Q&A next time, and we can just go through that stuff. But
Yeah.
always good talking to you.
Thanks.
Seriously, thank you so much for coming in. You
Thank
can
you
be
for having
found
me.
at Dose Wellness as
I can
well.
be found at
Another
Dose Wellness.
amazing provider at Dose.
Yeah.
So if anyone wants to schedule an initial consultation with you, come in.
Yep.
You can do that in the office or via telehealth if you needed to here in Arizona. But Dose will be coming out with a lot of content as well that will help, answer a lot of these questions for people that maybe aren't here. But if they want to find you, dosewellness.com, Dose Wellness AZ on Instagram. And then what would be your personal Instagram if someone wants to follow?
So
you?
I am at KaseyRay.theholistic.pa.
You're not going to remember that.
You're not going to remember that, but we'll link it.
I'll put it in the thing. Yeah,
we'll link it.
link
Kasey
in
Ray, the Holistic PA.
Yeah,
She is
the Holistic PA, and
that
she's
is
awesome.
me.
So anyway, thanks for coming in, Kasey. Appreciate
Thanks,
your time.
Colby. This was awesome. Thank you.